Hi, everybody. I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I'm excited to be joining the National Academy of Social Insurance for this timely conversation on Illinois' long-term care infrastructure. But before discussing any of the important policy issues that will be covered during today's webinar, I want to pause to solemnly acknowledge the deep pain that so many of you have experienced during this pandemic, especially those who've lost loved ones due to COVID-19. Yet for as difficult as the past 8 months have been, my hope is renewed every day when I see the ways that our communities have come together. There are essential workers in nursing homes who have cared for their residents as if they were family. Small business owners who have adapted public health guidelines with creative solutions to continue serving the food we all love. And healthcare workers who made heavy sacrifices on the front lines of the fight against this virus. I'm inspired by the resiliency of our community, and I'm committed to doing everything that I can in Congress to ensure that we emerge from this pandemic stronger than ever. To do that, we need to make robust health and economic investments, strengthening our public health infrastructure, expanding the healthcare workforce, and providing direct financial relief that individuals and families are relying on. And as we act to save lives and livelihoods, it's imperative that we prioritize our neighbors who have been most severely impacted by COVID-19: seniors, people with disabilities, and direct care workers. Although every age demographic is at risk for contracting the virus, older adults face disproportionate levels of risk for severe illness. In fact, Americans over 65 represent nearly 80% of coronavirus deaths in the United States. We also know that people with disabilities face elevated risks due to COVID-19 from both social, economic, and health factors, including underlying health conditions and living arrangements in congregate settings. And finally, we know that the workers who care for our most vulnerable populations face higher risk for contracting COVID-19. These trends drive many of the glaring racial and ethnic disparities that emerged at the beginning of the pandemic and have only worsened in subsequent months. More than half of direct care workers are people of color, and most of these workers are women. Data from the Centers for Disease Control and Prevention also show that Black and Hispanic Americans are 4.5 times as likely to be hospitalized from COVID-19 as white Americans. If we want to address the key drivers of adverse outcomes from COVID-19 and these stark disparities, then we must advance policies to protect residents and workers in long-term care facilities during the coronavirus pandemic and beyond. One bill I've championed with my Illinois colleague, Congresswoman Jan Schakowsky, is the Bicameral Quality Care for Nursing Home Residents and Workers During COVID-19 Act. This bill would protect the health and well-being of those living and working in nursing homes by increasing infection control and prevention, expanding testing, securing personal protective equipment, sending strike teams to the hardest hit nursing homes, mandating transparency and reporting of COVID-19 cases and fatalities, and requiring the Centers for Medicare and Medicaid Services to conduct better oversight of these facilities. We also know that healthcare costs, which were already crippling for so many Americans before the pandemic, are even more urgent of a concern now. And that's why I've championed the Affordable Insulin for the COVID-19 Emergency Act, which will require that seniors who are enrolled in Medicare Part D prescription drug plans be able to obtain insulin and associated medical supplies to manage their diabetes without facing any out-of-pocket costs during the COVID-19 emergency. The bill would also ensure that Medicare beneficiaries can obtain a 90-day supply of insulin by mail without the additional risk of going to a pharmacy. And finally, I've co-sponsored legislation to ensure that long-term care facility residents can stay connected with their loved ones and family members using digital technologies and other legislation to improve quality of care and safety measures in long-term care facilities through funding infection control enhancements during this pandemic and into the future. Because for as much as we need to focus on COVID-19 now, it's also critically important that we think about policy solutions to permanently strengthen Illinois' long-term care infrastructure. We need to think boldly, advancing ideas that will promote both clinical excellence and quality, and equity. I know that the speakers who will be participating in this panel discussion will share many of these innovative ideas, and I hope that you have a great conversation. Thank you again for the opportunity to join you today. I look forward to being together in person again soon, but until then, take good care of yourselves, everybody. Bye-bye.